Good morning. Now today we are going to discuss about some more topics of psychiatry. First one is about tobacco. In tobacco, it is the most common substance abuse in India after the alcohol. After that, alcohol comes. And in this we learn this by I have a stone in between my fingers. So Fager Strom test is done to check for smoking addiction. Smoking tobacco contains nicotine, which increases in choline synthesis, which increases concentration. So, on discontinuation, degrees of concentration agitation is seen in the patient. For antidote, we gives varenicline used for management, produce suicidal thought as a side effect. It produces suicidal thought as a side effect. Now, second substance abuse is opium. It is a CNS depressant. Other its manufactured form is heroin, which is diacetylmorphine. Chasing the dragon. Main points are chasing the dragon, in which is no. It is a method in which on the silver foil powder is taken and below a fire is produced by the lighter, and the burning causes smoke, and the smoke is inhaled in a serpentine manner, so it is called chasing the dragon. In the main inhaling, when all the peripheral veins get thrombosed in the patient of coronary use, it is directly inject the cocaine in its baseline. Now, heroin in pure form is white powder. If mixture adulterated by baking powder or some other chalk powder, it gets a bluish or blackish brownish color, so it causes brown sugar. Most common triad seen in opioid poisoning is pinpoint pupil, respiratory rate decrease, which is the most common cause of death in patient, and hypotension, decreased blood pressure. Treatment antidote is IV naltrexone. For maintenance of abstinence, we give methadone and buprenorphine, and for antidote is naltrexone. Now, CNS stimulant comes cocaine. Another CNS stimulant is amphetamine. Cocaine. Free base preparation is called crack. On chronic use, it causes black tongue. Mode of action is it decreases dopamine and norepinephrine uptake. It decreases dopamine and norepinephrine uptake, so it causes increase in dopamine and norepinephrine in the synaptic cleft, in the mesocortical mesolimbic pathway, which causes schizophrenia-like symptoms if in chronic high dose. Because of increased norepinephrine in the synapses, it causes high BP, tachycardia, and vasoconstriction. Vasoconstriction, it has a therapeutic use in anti-surgery for stopping bleeding. For coronary artery, it can cause MI on vasospasm, on septal perforation after vasoconstriction of the blood vessel supplying the septum, which causes necrosis, and after that the septum hole can be seen. Comes the cannabis. Cannabis is CNS depressant. It is most commonly weed or he and many other names. He and she is for use for cocaine. It is extracted from cannabis sativa. It is a mild dependence. First it considers it has no dependence, so it is properly abused, but now mild dependence is seen. Its active compound is delta 9 tetrahydrocannabinol. Hemp insanity. Now, most common medical aspect is hemp insanity. It causes cannabis-related psychotic disorders. Flashback phenomena. Even after not taking the cannabis, patient experience same kick just because of the flashback phenomena. which is very cool to hear. But if in a important place like where while you are driving, if flashback phenomena occurs and you does not concentrate on the driving, it may cause serious results. Amotivational symptoms, because it can cause gives false sense of motivation. So after chronic use, it causes amotivational syndrome, or after withdrawal. Run amok means suddenly patient runs and kills everyone which comes in his contact, or his enemy, uh, and after that he also surrenders, because he says, I don't and it is not clinical, it is in eternal monk, it is a psychotic illness, so it is not, so patient is not clinically illegally liable for the crime he is doing, so better to run away from him. Reflex hallucinations are seen in LSD and bhang. Reflex hallucinations means perception stimulus perceived in one form and perceived in different form. Like when you see bird, you hear a sound different from a bird sound. So stimulus is perceived in a form of visual, but hallucination occurs in visual auditory form. Mild reversibility, its toxicity reversible, gets reversible. And remember, for all substance induced psychosis, symptoms should resolve within 1 month of removal of substance. If not, it shows illness of brain. Now comes stupor. Stupor means mutism, echinacea, decreased movement. Mutism, decrease talkativeness, and decreased talking, and to decreased responsiveness to external and internal stimuli. Stupor is just before a stage of coma. In this, patient remains conscious, but once the patient loses consciousness, it enters into coma. Stupefying agents are also called, so that which are used for death, rape, drugs, or for looting, for heist in police stations. The stupefying agents most commonly datura. Twilight is consciousness restricted to one idea. Like twilight, you can compare with tube light. Switch on and switch off alternatively, so it shows only stuck to the one idea. On a ride, dream like a state. On a ride can be learned as on ride of dream. Torpor, generalized lowering of consciousness. When you get a fever, or after this chronic illness, you gets in a generalized lower of consciousness. Delirium is most common neurocognitive disorder, not oriented to time, place, and person. If in acute phase, it is called delirium. If in a chronic state of more than 6 months, it is called dementia. Delirium is also called as altered sensorium, clouding of consciousness, acute confusional states, drowsiness. All these are named delirium. If after major surgeries or severe burn, ICU psychosis, if present with visual hallucinations and delusions, acute psychosis is alterations. Acute psychosis. For treatment of the delirium, we have to treat the main cause. If it is because of alcohol, so we have to treat the withdrawal of alcohol symptoms, and if it is because of electrolyte disbalance in ICU, so we have to correct the electrolyte disbalance, and or in the severe burns, or in the major surgeries, after the major surgeries. It shows some of the special phenomena like sleep reversal, like patient is fully sleeping on the day and gets up at night. Fluctuating course means patient can be manic and then be angry, and then be manic, very happy, hypomanic, not like bipolar, because but fluctuating. Like doctor asked him, how was your day? So he patient started with saying, my was day was very good, and starting getting good compliments, and after that he suddenly cursing the system or cursing the staff, and so it is a fluctuating course. Picking behavior or floss flossillations means it picks up all the catheters connected to the ICU. It's sundowning phenomena means symptoms get worse. Symptom gets worse on sunsetting, because patient get oriented because of some sun rays or sunlight, and after that this orientation is also gone, so patient get more agitated and angry. Comes in the eating disorders. Mainly we have to discuss anorexia nervosa, bulimia nervosa. Next one is binge eating disorder and avoidant restrictive food intake disorder. For anorexia nervosa, it is a most common type of eating disorder is binge eating disorders. And for anorexia nervosa, misnomer. Anorexia means misnomer because there is no change in appetite. Appetite remains same, but patients become anxious about their body weight. They get a false image that they are obese, but even though their BMI lies in normal range. It is of two types: restrictive, in which patients refuse to eat, or very selective, and workaholic or excessive gym doing, and no binge eating or purging is seen. Another type is binge eating and purging type, in which patient binge eat and then purge. Treatment is CBT plus SSRI. It is a gold standard for most of the psychotic treatments or in the psychiatry. Another one is cryptoheptadine for increasing the appetite. Refeeding syndrome, if suddenly the patient is fed with more good food and excessive amount of food, it causes free radical injuries, causing refeeding syndrome. So slowly refeeding is done. Next one is bulimia nervosa. Bulimia nervosa can be recognized as binge beyond fullness, जिसे हम हिंदी में कहते हैं गले तक भर लेना खाना. आइसोलेशन अलोन रहेंगे, ठीक. नेक्स्ट एन फॉर नॉट हंग्री, they eat even though when they are not hungry. Guilt, they get guilt of eating excessiveness after eating rapidly. They eat so much rapidly, uh, you can compare about from any of your friend which eats very fastly. Episode more than or equal to one per week for last 1 month. Some sign is seen: Russell sign, callus on the knuckles because of induced vomiting by putting fingers in throat. Mallory Weiss tears because of excessive vomiting. Treatment is CBT and cognitive based therapy and SSRI. Most common type of eating disorder is binge eating disorder, in which a patient binge eat once a day in a week or month. It is the most common type of eating disorder. Avoidant restrictive food intake disorder. It is it is seen when patient has no care of body weight, but it is not able to for because his hunger is less because of some unpleasant memory of experience for connected with that food. My personal experiences, when I go to a hotel, and we order fried rice. There I eat the fried rice, and after that I develop food poisoning, and so I treated it takes about one week, and after that I literally hated the rice, even though it is made on our mess, or in my home. I literally not ate any single rice seed for one whole year. And it can become in the avoidant restricted food intake disorder. Eating disorder: if eating less or eating more. If eating less, And BMI, eating less with no due to taste or smell. It is avoided restrictive food intake disorder. If due to body image, it can be anorexia nervosa restrictive type. Binge eating, if purging is present, so then most commonly, if there is no mention of BMI, then it is most commonly anorexia nervosa. If BMI is normal, then it can be bulimia nervosa. According to ICD-10, it is less than 17.5. ICD-11, it is less than 18.5. If purging is not present, then it is binge eating disorders. For assessing anorexia nervosa and bulimia nervosa, we follow a SQOF questionnaire. Persistent. Now for the definition of personality. Personality is persistent and pervasive lifestyle of individual by which anybody is known for after the start of adolescence till the age of 40 or old age. Before adolescent we don't have any particular personality, and after the 40 we gets mature enough to understand all types of behaviors. In between we get a fixed and inflexible personality type which is ego syntonic, which means it is not